Welcome back to part 2 for our ethics and legal NCLEX style question. If you guessed answer A or answered option A, you are correct. But I always say it's more to just know the answer. Let's understand and walk through why A is the correct answer. Okay, so in this question, we need to break down a couple of things. Number one, we need to understand that this patient is on hospice due to respiratory distress. And when a patient goes on hospice, we are all concerned about promoting comfort care, right? We want to keep this patient comfortable. So if this patient is in respiratory distress, which they're giving to us, that indicates that there's going to be some sort of medical intervention that is warranted or needed, okay? Which would require a designated individual, which in this case, they're telling us the sister is the client's designated healthcare power of attorney, and they want to know what action is appropriate for the nurse to take. So we know the correct answer is option A. Let's walk through options B, C, and D as to why they're incorrect. So should the nurse inform the daughter that the client requires mechanical ventilation? Well, that's considered a medical intervention, right? And if the sister is the client's medical power of attorney, that would be inappropriate to inform the daughter of that because we would need to obtain consent from the sister who is the healthcare POA. Okay, C is incorrect because the POA stands as a legal binding document, in which case the sister is able to make healthcare decisions, so we don't need a copy of the living will. And D is incorrect because we are not going to ask the daughter about the client's medical wishes. The daughter may very well know the client's medical wishes, but again, the sister is the client's healthcare POA, so we are going to obtain approval from the sister regarding any medical decisions regarding this patient. As always, if you found this helpful, please make sure you're following this page, save this video for later for your reference, and share this with a future nurse.